Psychiatrists, what made you realize that the person was not doing well? I can teach you guys about the flight to health that happens after someone survives a suicide attempt. You'll talk to them, and they have all these genuine plans to make their life better. They're enthusiastic and ready to get out of the hospital to start their new life. They are going to quit their horrible job, love their family more, etc etc. I am always incredibly worried for these patients because soon the depression slowly brings them down again. It's hard because convincing these people that they still need a lot of help is difficult because they're completely genuine. I knew my psychiatrist wasn't doing well when he spent the whole 15 minutes pacing the room, complaining how his ideas were not taken seriously by the other doctors at the hospital unit he headed. It was pretty surreal and hilarious. I just let him vent because he seemed to need it. I should have charged him. Mine answers phone calls in the middle of a session. Patient here. When I mentioned I dismantled every object in my house that had screws, she thought I might be just tad bit manic. She was right. Well, it was pretty obvious that you had a screw loose somewhere. Not a psychiatrist, but my close friend is an LCSW. She always tells me that marked improvement in a short time without any root cause is a huge red flag. For example, if a clinically depressed patient suddenly starts seeming incredibly happy for no reason, it's a sign that something is wrong. Psych nurse here. I had a friend who was never happy. She was in okay moods, could laugh and all that, but she rarely voiced positive emotions. Had a history of past suicide attempts, so she was a friend we always checked on and kept her close with us. The week before her suicide, she became extremely happy and giddy. She behaved like she had never done before her life got ruined thanks to some events I won't discuss. I saw this and voiced my concerns. I knew it was a sign that a suicide attempt was coming. This behavior is typical on patients who are planning to end it, in most cases. This time we didn't get to her in time. We miss her dearly. I married someone with BPD and I know the signs when she isn't well, but thankfully I can act before stuff happens and she has not attempted on her life or harmed herself in 2 years. Hey, so, I have BPD, and a lot of people can't handle me or my emotions and my depressive outbursts. What you said just gave me a lot of hope that someday, someone will care enough to stay. Serious answer. I've worked both inpatient and outpatient. It truly is rewarding to see your care plan help someone. First time I meet them, I go through a whole history, physical, and review of systems and symptoms. Psych symptoms. I get people that genuinely start crying. Usually sleep pattern disturbance is a big indicator. Anhedonia is the hallmark sign of depression. It is a loss in pleasure in things that you used to enjoy, like gardening or video games. There are suicide warning signs, such as giving personal belongings away. There are so many signs for different illnesses, such as bipolar. I'll get a man who is spending his rent check or having risky and unsafe sex. It truly is interesting and rewarding. Very subjective. I really wish I had noticed my uncle giving his things away as a sign. I knew he was suffering, but it all made sense after he killed himself. I'm not angry at him that he did it. He was a quadriplegic and was getting on in years, and didn't want his family burdened with his care. I am angry at myself for not spending more time with him. After seeing my psych for almost a year, finding out that no, I'm not haunted, it's just the PTSD and anxiety, and a bunch of other revelations. I had an appointment where I told her that for the last month I'd been happier than ever. I was walking on sunshine and for the first time in 15 years I'd gone a week without any suicidal thoughts, food issues, self-harm urges, or anxiety attacks. At this, she urged me to immediately set up talk therapy and schedule all my appointments ahead while I had energy. She saw that uptick as the red flag it was, but I didn't listen to her. Now 8 months later I've called her one time, barely shower or eat, and I'm back at my worst mentally. It's fine though, I'm used to it. I hope you get the help you need and can learn to feel better. I'm in a very similar boat to you. I'm not a psychiatrist, but I do have a master's in clinical psychology and worked in the mental health field for 10 years before I had to switch careers. 1. Anytime somebody describes themselves as lazy, I almost immediately know they're probably experiencing anhedonia or some other mental health symptom. 2. A lot of people underestimate how bad their mental health is. People often think others have it worse and think they're somehow taken away from people who need the help. 3. They say they haven't had any energy lately. There's more, but I'm tired. I'm working on my PhD in psychology, so not a psychiatrist. At the beginning of the pandemic, I started working with a kid over telehealth. Her parents wanted her to do therapy for depression. She was pretty hard to work with over video because she would take a while to respond to what I was saying, and sometimes I would have to repeat myself. She would also start randomly smiling, laughing at whatever was on her screen. I figured she was messing around on the computer during our sessions until one day I saw that she was looking at herself in the video call. From that and the disorganized thinking, my supervisor and I figured out she had psychosis. Parents wouldn't listen and she had a full-blown psychotic episode that led to a multiple-week hospitalization. The poor kid was completely lost to her delusions and hallucinations, with her parents more concerned about her not being able to do her schoolwork. I was the patient. Before our first meeting, she asked me to write her an email summarizing the concerns I had that led me to seek help. Upon arriving, I asked if she'd read it yet, and expressed concern that I was overreacting, making too much of very little, and wasting her time. I was even a bit embarrassed. She had read it, and I was informed that based upon my description of what led me there, a huge part of my problem was I'd slowly, over time, allowed myself to be convinced that everything I was enduring was normal, when in fact, it was highly abusive, in the emotional sense. That revelation was huge when I realized addressing what I needed to face and overcome was much larger than I'd ever imagined, and just how much doing what I needed to do was going to hurt, and that it was going to hurt for a long time. I say all that to say, if anyone is wondering if they really need help, or if they're just mentally overreacting, in either case, it certainly wouldn't hurt to seek out a professional you're comfortable with, and get some feedback. Well, I'm only a PGY1 psychiatry resident, so I don't have a lot of experience yet. I don't want to get into specifics, but usually talking to the family to get collateral information plays a huge part in determining how serious a patient's risk of suicide is. I've talked to patients who seem totally okay, swear to God it was an accident, they forgot they took too many sleeping pills, blah blah blah, they have future-oriented thought process and all the markers of being low risk, and then I talk to their family and it just goes down the toilet. Patients lie or have a post-attempt glow where they didn't expect to survive and are suddenly thinking everything is okay, so you can't trust them too much. Beyond the normal things other people have mentioned, but if I talk to a patient's parents, partner and pick up a lot of cluster B personality traits, I really worry about that patient because of their lack of social support, regardless of how well they think they are doing, because you just know they are going to be discharged into a toxic home life. I'm a psychotherapist, not a psychiatrist. I notice a client getting worse if their sleep or eating habits change, anhedonia, trouble with concentration focus when there wasn't an issue before, or they start to socially withdraw. Huge red flags if they start to give away personal items and all of a sudden feel happy. It takes a while to get severely depressed, etc., and it'll take a while to feel better. These huge red flags indicate suicidal thoughts and possible planning. Not a psychiatrist but a therapist. When a person has a hard time understanding that their self-destructive behaviors are affecting themselves and their loved ones, to me, that's an indication that something else was going on. Trauma, addiction, etc. As a mainly inpatient psychiatrist, I already know before I see them that they aren't doing well just by nature of them being admitted. When I see folks in the ER and I'm determining if they need admission in the first place, it depends. Not doing well because they are manic looks much different than not doing well because they are depressed versus not doing well because they're psychotic, etc. I had to tell my psychiatrist recently that I found an old friend in the cemetery, visiting my dad who passed unexpectedly. He told me he can't go there because he would recognize too many names. The man has been with me over 10 years, has seen me through a lot, and is one of the reasons I'm still here. I always figured I needed plenty of help though. Dang. Over here you can only get 10 sessions because that's all insurance will cover. Post-college girlfriend's father, GFF, was a psychiatrist and professor. GFF was in his office talking to a D1 football lineman, FLM. FLM was a big guy, so 270 plus lb, 6 feet 5 inches. who was experiencing the beginnings of a psychotic episode. GFF asked FLM why he had come in. FLM said that he'd been having thoughts about killing people. GFF asked who the thoughts were about and when he had been having them. FLM said right now, and he was thinking about killing GFF. GFF was able to talk him down and get out of the office. A lot of not a psychiatrist. Pardon for the inconvenience, I just looked up what a psychiatrist is. Again, please pardon for the inconvenience. From now on, anyone who specializes in mental health can share their stories. This is only like the 10th comment from the top for me. It's fine. Not a psych, but I've been to plenty. The moment when I realized I wasn't making up my issues wasn't the first time a counselor ran out of the room sobbing during one of my sessions. It was the second time. The first time, I knew she had MH issues herself. Bad divorce. I figured I must have just been there at the wrong time. I gaslit myself intensely about the severity of my life experiences, and was only 16. The second time, she gathered herself, stopped my story, came back in, and referred me for urgent help with the nearest psychologist. I was put on antidepressants that day, had an apt within a fortnight for an hour-long intake with a psychologist, which is excellent for MH issues in the UK, and left his office with a therapy referral and 8 diagnoses. I've since gone into remission with a couple of them now. Depression still kicks my butt and so does anxiety, but I've got a much better handle on it. I've worked in psychiatry as an MD, but not a psychiatrist. Sometimes you can have a polite, friendly conversation with someone who seems normal. Then you talk about a specific topic and an enormous system of delusions unravels. Then you're like shit and it makes sense why they are admitted. Then there are the obvious ones crying, hallucinating, etc. People most often are very honest and want the help, so it's quite obvious what the problem is and that they are not doing well. As a patient, about halfway through my first session with a psychologist, she stopped me to ask if I was medicated and what I was prescribed. I was not, and the look of disbelief and tentative concern was both an amusing and dang, I really am broken moment lol. He's still not medicated and I know I'm not broken. My therapist has a huge sign in her office that she had made. It says, "I'm not broken, I'm breaking through. I'm so happy you know that you're not broken. Hope you're doing alright, and if you're not, I hope that you're getting the support and care that you need." I'm not a psych either, but as someone who has both been to many and many psychologists, therapists, and done thousands of hours of research into psychological phenomena and mental illnesses, there's a lot you will see in day-to-day just browsing social spaces such as Reddit, where people will share rather freely, or Discord, where people in smaller servers will trust others enough to talk. There's a lot of ways to not do well and there are signs for all of them. The biggest, of course, is the very thing which makes a disorder, a marked impairment to functioning at the level others appear to. It'll be described in many different ways and manifest in many more, but the basis to tell if someone isn't doing well is that the kind of not doing well depends on in what way they find they're lacking in comparison to others or how they believe they should be doing. If anyone is asking, how do other people do, basic task, or similar, I don't get how other people can smile genuinely. It's likely something is wrong, either mentally, chronically, physically, or because of neglect. If you suspect you're mentally ill or have a disorder, but are having doubts, take this excerpt from Immune by Philip Detmer. It's about physical health, specifically infectious diseases, but mental illness is called mental illness for a reason, and it applies to health in general. How crucial health is becomes most apparent when it is missing. Health is really an abstract concept because it describes the absence of something, the absence of suffering and pain, the absence of limitations. If you are healthy, you feel normal, you feel right. Not a psychiatrist, but at a general medicine checkup I had cooked up decently involved infectious disease workup for a patient's rash from which he claimed to have seen insects crawling. Then I noticed a Seroquel branded pen sticking out of his pocket, which didn't exactly jive with his telling me he had no medical history and wasn't taking any medications. I was telling my doctor I was having trouble concentrating. I told her, sometimes I feel there's, like this other world. It's just within reach but I can't quite get there. It's so nice and so peaceful, like waking up from this wonderful dream, and you want to go back to sleep. to be in that dream. She put down her iPad and looked at me very intently and said, "Have you ever seen a psychiatrist? I think you should see a psychiatrist, not a psychologist, a medical doctor, as soon as possible. Not a mental health professional." The patient: "Hi, I swear I saw the light bulb go off in my therapist's head when I admitted in our second session that I'd cried for 2 hours after our first session because I was convinced she hated me for being so selfish. Turns out she didn't hate me. Wild." My psychiatrist told me that she could tell I wasn't doing well when I had had 7 previous suicide attempts and actually told her I had a plan for the 8th. Not only did she know I needed help, but she knew that I subconsciously wanted help because I told her about my plan. She's told me that she can also tell when I'm not doing well because I sit differently because of how my pants rub against my cuts. She's such an amazing psychiatrist in the fact that she can tell just from how I sit, and is 99% of the time correct, that I need help and guides me through every step of the way to get it. She also goes out of her way to see me when I'm inpatient even though she's typically outpatient PHP only. Not the psychiatrist, but I was the patient when I got diagnosed with anorexia, bulimia and borderline personality disorder. He realized I wasn't going well, told me I was too complex and at risk for him and dropped me. Many psychiatrists won't attempt to treat people with borderline personality disorders. Don't need to be a professional for this one. Did you ever notice that person on Facebook posting nothing but inspirational and motivational posters, pictures, messages? Yeah, that's a huge sign they're not okay. Can also be toxic positivity. Mine is the opposite. I was seeing this psychiatrist for the first time and he got drugged up quickly right before my session. The session ended up this incoherent blabbing and me trying to act like he's in a normal state. Luckily after a while his wife called him and demanded talking to the patient. I talked to her and she urged I leave immediately. I explained how that's what I wanted, but I was legitimately scared. I was able to leave soon after. I was petrified and didn't know what to do. I decided not to report his behavior. Maybe it was a mistake, but I felt like we're all human. I was there to stop self-medicating, sabotaging with alcohol, and I was embarrassed thinking how I did similar things, so ironically he made me stop for a while. Report it. You don't know if the next person will handle it as well as you did. How to remember the difference between a psychiatrist and psychologist. Psychiatrists can prescribe drugs. Psychologists cannot prescribe drugs. Psychologists have an O in their name. No drugs. Patient here. It was my first appointment with my therapist. I'd met with 2 therapists previously who I never got far with and hated seeing because the way my mom had described me to them was that my behavior changes were sudden and all my fault, and she obviously had nothing to do with it. With this third therapist, my mom was in the first appointment with me to get both sides of the story. After my mom left, my therapist told me that she could tell exactly why I had developed anxiety and depression. I was very close to forms of self-harm and eating disorders because of my family situation. I was just pushing it all aside and stonewalling myself whenever conflict arrived. It was also that day I realized my mom wasn't doing well either. A buddy of mine is an adolescent counselor. He said, a lot of times he is working with a 16-18-year-old just trying to give them coping mechanisms until they can't move out of their toxic home, hoping they will use those methods to feel normal once they hit college or adulthood. In other words, most of his clients have unhealthy parents. To be honest, I don't feel so well, and going through this thread was a big mistake, and I'm feeling kinda devastated and hopeless about my future. When killing themselves stops being serious and becomes a perfectly normal thing to say, or worse, a joke to them. Source: I was on suicide watch this time last year. I'm okay now, but those caring for me said this. TFW, you joke about how if you were to die it would be by your own hands. The people who are dysphoric and or depressed but have energy and motivation worry me. The people with energy tend to act on it. People whose depression turns around extremely quickly for no apparent reason, who now want to do all these things and minimize their depression. They worry me. People who are flippant, a lot of I don't know, whatever answers are also worrisome. I am a therapist. I can't reveal information about my clients, so I'll share the story of an old friend instead. Dude was always slightly depressed and mildly resentful of those around him that had built their lives up. One day he came over and was completely different. He knew the key to life and knew what to do about it. The thing to do was to fly to another country where he didn't speak the language and become a religious leader by merely peering into other souls. Dude was so unwilling to work on himself he had a psychotic experience to try to make himself instantly better. I helped him get help, but he did not stick with therapy. Takes meds, but without the psychological work meds only do a little, and then ended up really going off the deep end. He needs to deal with why he sits at home all day and hides from the world, but he won't. So he keeps just having breakthrough psychotic episodes instead of working on his stuff. Sad to watch. Unfortunately, you can't be the therapist to your friend or family member, so besides checking in every now and then, there's not much to do. Psychiatrists generally don't talk to people. They just prescribe medications and get all the info about how you're doing from a therapist or counselor. This isn't true. Psychiatrists meet with patients often monthly or quarterly for discussion and evaluation. For the prescription of many medications, this is required by law. A psychiatrist who never spoke to patients and evaluated their mental health would be very, very rare. Psychiatrist here. Old adage. Are they able to work and to love? Mind you, a psychiatrist is by no means the only answer to difficulty doing both. I do both those things and I'm still miserable. Patient here. I am actually at the end of recovery. I have no more mental health problems. I don't take any medication. After I become employed, which will happen soon, I will be done with therapy. I won't have any more meetings because there won't be anything left to talk about. Advice. Starting medication is not a bad thing. I was so sad when I was prescribed pills for depression. The only people I heard of who took pills were people who took them from the streets, Dr. House, TV, who was an addict, and people who had a lifelong illness. But I really needed them and they really helped, and I take nothing now. Took me 6 months to reduce from full prescription to no medication. It's okay to take medication. It's not a life sentence and you're not bad in any way for having to take them. Progress from going to rock bottom and broken all the way to being so happy, hopeful and looking forward to a bright future takes a lot of work. I was so stressed at the beginning because I wasn't where I wanted to be. It felt like I wasn't making any progress. I didn't realize this until the end, but how it actually works is progress starts as the tiniest snowball. You don't even know it's there. Then you keep going bit by bit. It's okay to not work on yourself every day. It took a lot of practice for me to be able to work on myself every day. You also need to look not just where you want to be and where you are now, but behind you. You need to be proud of any progress from where you were. You need to understand the past and how you got there to really improve on yourself. You aren't supposed to live in the past, but you are supposed to understand how you got to where you are to pave the way forward. And by the end you end with this massive beautiful snowball that you are proud of. I am so proud of where I am and my snowball. I am not ashamed in any way for how I felt or how I was back then. Neither should you. It is so hard to work on yourself and takes a long time. It took me 6 years from broken to now, but it is worth it. Trust me. Take those steps forward. Keep building your snowball. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.